Hey everyone, welcome back to the channel. So today what we're going to talk about is jaw pain or TMJ dysfunction. So TMJ dysfunction is basically the temporomandibular joint, and for people who have TMJ dysfunction, we want to use today's video to highlight one really effective treatment exercise. We can sort of break up into two parts that'll help you sort of address the symptoms and hopefully get some of that pain and dysfunction under control. But as we always do with these videos, if you hang around towards the end of the video, towards the second half, we want to make sure that we have a really strong conversation about why TMJ dysfunction occurs. And there's an idea that gets lost a lot when we're treating jaw pain, where we just look at jaw pain as a problem with the joint. We forget to look a little bit broader, and by not necessarily looking beyond the jaw, we can really miss, I guess, one part of the body that's crucial in developing jaw pain, but also the flow-on effect from that of what causes all of this in the first place. So aside from someone who's been hit in the jaw, you've been punched in the jaw, something like that, you've had direct trauma, there's some really clear, simple mechanical dysfunction that has to occur to set up this chain reaction of events that ends up in TMJ dysfunction. So if you have a sore jaw and you're not really sure why, if you hang around to the end, well, hopefully you'll get a good understanding of how it all fits together, and then we'll show you something to do to try and change that. So we want to make sure that after watching this video, you've got something to hopefully help with your symptoms, but also something to treat the cause, and then something to think about overall to try and make sure that this goes away quickly and doesn't come back again in the future. So to start with, I guess the important thing to understand about the TMJ joint, or the TM joint, sorry, the temporomandibular joint, is it sits just in front of your ear. So it's not down low, even though we call this the jaw, we know that this is the jaw. The actual joint itself sits just in front of the ear. So if you've got your cheekbone, if you follow that back to your ear and come down a little bit, that's where you'll be able to feel the joint moving, the jaw joint actually moving. And if you put a finger on either side and then open and close your mouth, aside from looking ridiculous, what you'll find is you'll be able to move your fingers up and up and up and up until you feel like you hit the joint itself. Now, one of the things that's really important to note before we get into the treatment of this issue is that you want to get a sense of how symmetrical your jaw moves. So if you've got a finger on each side and then you open up your mouth and close your mouth a few times, what you might find is that one joint or one side of the joint feels like it maybe moves sooner than the other. So instead of the jaw often moving symmetrically, a lot of people find that their jaws will move asymmetrically because there's some pre-existing dysfunction there. So what we sort of want to look at when we're trying to address these symptoms is you want to take an immediate initial gauge of how it moves, and obviously whether it's sore or uncomfortable, and then you want to do this exercise and then retest it at the end so you feel like you actually made some change, so you know you've made some change. Now, the exercise is really simple. We're going to get into the two main muscles, I guess, that influence the jaw and its movement. And if we find that cheekbone again and come down from that, we've got a muscle here called the masseter muscle. So it attaches from the jaw into the skull, and we've got the temporalis muscle above the jawline, which attaches from the skull to the jaw as well. So the important thing is here, if you place your fingers just underneath the cheekbone and you open and close your mouth, and even if you clench your mouth as well, clench your teeth, you should feel those muscles tense up. So you should feel the masseter muscles under the cheekbone. If you come just above the cheekbone, just in front of your hairline, and clench your teeth again, you should be able to feel a gentle tensing. So those two areas are the areas that we want to focus our attention on. We want to feed some slack into those muscles, free them up, and use that extra mobility to improve the function and the way that jaw joint moves. So the first thing we want to do is, with your mouth closed, below the cheekbone, we just want to dig your fingers in. So we want to do two types of motions here. We want to try and do an up and down motion and be guided by where it feels tender and tight. So just move it up and down towards your ear and then coming out sort of closer towards your mouth direction. You should be able to find some tight spots that you can gently try and work out as you move your fingers up and down. Secondarily to that, we can get you to move from side to side. So again, starting from in front of the ear, moving sort of towards the mouth or more towards the mouth. Make sure that you're centering on the areas that feel the most tender and work up and down and side to side. You can work around if you want to, but the idea is you want to promote some movement into those tissues. And then again, once you've done that, you want to reassess your jaw movement. And for me, it actually feels like that left side, or this side for me, is moving more smoothly than this side. So obviously we want to even that up and do both sides. Once you've done that, we want to move above the cheekbone, more towards the temple, that temporalis muscle, and then we want to do the same thing. So we want to move it up and down. Go looking, so as you move towards your eye, go looking for some areas of increased tenderness. And then same thing, we want to go from side to side as well. Same deal, looking for things that feel tight, looking for things that feel tender. And we want to spend 30 seconds to a minute on those areas and then reassess again. And again, that feels looser again for me. So I don't have any jaw dysfunction, but obviously there's a very low grade level of tightness there for me, which again, potentially makes sense when we get to the reason why these things occur in the first place later in the video. So the first half of that exercise is finding the muscle below the cheekbone and above the cheekbone and just trying to get those tissues moving more, and then reassessing the quality of your jaw movement and pain and your symptoms to gauge that change. Now, the second part of the exercise is exactly the same thing, but this time we want to do it with your mouth open. So we want to put those muscles on tension and then do the same thing. So obviously I can't speak while I'm doing it, but it basically looks as follows. So you open up your mouth as wide as you feel comfortable, and then you want to go hunting again. So we're going to go up and down and side to side. We're going to go looking for those areas of tightness. So for me, as I sort of hook around more towards the mouth opening, for me I find there's a nice tight spot in through there. So again, you look ridiculous doing this, so please do this in the comfort of your own home, away from prying eyes, or if you don't care, do it when you're walking down the street. But the idea is that we want to promote some movement here. So we want to open that mouth again. We'll do the same thing. So those two parts of the exercise are really important. We want to try and find the muscular tightness with your mouth closed, above and below the cheekbone. We're going to do the same thing with your mouth open, just because we don't want to miss anything. Because obviously your jaw opens and closes. We don't want to miss any tightness along the mechanics of those movements. So you can try the same thing where you find a tight spot and you can come at it in the other direction where you open and close your mouth while you're putting pressure in. So basically if you put some pressure in there, and then open and close your mouth, you can try and shear some tissue free that way. So, but the idea is that you want to do that as an exercise, then reassess your jaw movements and get a sense of what's changed. Because if you've made some genuine change in terms of the muscle mobility and flexibility there, you'll feel a difference in the quality of your movement and hopefully a difference in how your pain feels. So again, if you've had dysfunction for a long time, if that jaw's been painful for a long time, all we're looking for is some change. Hopefully you get a lot of change straight away from doing that. But if you can keep at that each day, you should feel like it consistently keeps getting better and better. So as I said from the start, it's a really strong and effective exercise to treat the symptoms of jaw pain or TM joint dysfunction. But the nature of those exercises and that treatment is it's only symptomatic. It generally addresses the current symptoms associated with the jaw. It doesn't enter into a conversation to say, well, what's caused those symptoms to be there. So again, if we don't have this next conversation, which we're going to get to, then we're potentially not taking away the reason why those tissues are being asked to tighten in the first place. And yes, you can have some arthritis in your joint. Yes, you can have some general dysfunction there, but those things generally are a consequence of broader dysfunction, which we're going to get to now. So again, as we talk about in most of these videos, we always want to have a conversation about how to treat something, but we also need to have a conversation about what the cause is, otherwise we're going to miss the bigger picture and we can't cure something or solve something unless we're looking at things from by taking a step back. So again, if you've been following these videos, you won't be surprised by what I'm about to say here, but the biggest cause, or one of the main contributing factors to the onset of jaw pain, TMJ dysfunction, is neck dysfunction. Now, if you ever get any headaches, if you've ever had any arm pain, some arm dysfunction, you'll know that the neck has a really central role to play in laying the foundation for dysfunction to express itself. Now, when we're talking about the neck here, particularly with the jaw, generally it's the top half of the neck. There's levels in your neck that have a number of connections to your face. So the top 2 or 3 levels have a lot of the nerves that can supply headaches, but can also innovate and create pain and dysfunction into the jaw area. And we've also got a lot of mechanical reasons where a lot of the neck musculature can attach into the jaw. So there's a connection there as it anchors from the jaw into the neck itself. So if you become dysfunctional in the joints of your neck, particularly the joints of your neck, that can create an indirect or a direct consequence of dysfunction that goes up into the head and face, which can then express itself as jaw pain. It can lay the foundation for jaw pain to exist and to come out of nowhere seemingly. So it's really important that we try and clear up a lot of this dysfunction in the neck. Now, a great way to do this, again, you would have seen this before, but it's really important to rehash this. So this is just 2 lacrosse balls taped together. You're welcome to use one. You can use a tennis ball if this is too vicious for you. It's generally quite gentle, but we want to make sure that you respect any symptoms that you have. So you can do this leaning up against the wall. Again, one ball's probably a little bit more specific, but we'll use 2 today just for something different. So we want to basically put the ball, so because there's 2 together, we can put these up at the top of the neck, sort of cradling the spine either side. If you have one ball, obviously we want you to be a little bit more out to the side. And what we're going to do here is you can do this leaning up against the wall if you want to, but we're going to do this on the ground here. And if you can see this, all I've got is the ball right up at the top of my neck, just under the base of the skull. And I'm going to turn my head to the side that I want to assess. And what this does is this biases the joints, the facet joints in the neck. And what we're looking for here are areas of tightness or stiffness more so than tenderness, because the stiffness and the tightness is the rustiness in the machine that forces something around it to become dysfunctional. So the way to find this is you want to find a spot, roll your head to that side, get a sense of how tender, tight and stiff it is, then just compare it to the same spot on the other side. Now for me, this side actually feels a lot more restricted. So all I want to do here is just stay here. I want to let the ball press in, spend some time pressing into these stiff joints, allowing them to give. Again, if you feel some pain or discomfort radiating into your jaw, that's perfect. You've just discovered a really crucial part of the puzzle. If you get headaches, this can explain those as well. So once you've found this point, once you've spent 30 seconds to a minute just letting the ball gently press in, so we're not rolling around on the ball, we're just finding a point, staying there and letting the ball press in. Once you've done that, we just want to move the ball down a fraction and repeat the same process. Get a sense of which side feels the stiffest. Generally, it's going to be the same side. It doesn't often switch as you go down the spine until you get to a different section. And then again, once you've found a spot that feels a little bit stiff, we want to stay here. So again, we're trying to use the pressure of the ball to free up and mobilize and separate stiff, glued down tight joints and take away that handbrake that can often lead to jaw dysfunction. So for some reason with a lot of jaw pain, the TMJ dysfunction, we often forget the role that the neck plays in this. It has a central role to play in the onset and the creation of a lot of the dysfunction. Even if you feel like your neck's fine and you don't notice any neck pain or stiffness day to day, if you have jaw pain, once you dig a ball into that neck, it's really likely that you'll find a whole bunch of stuff that you didn't realize was there. It's almost going through the wardrobe in Narnia to find this whole world that you didn't realize existed, and you were never going to notice that until you dug a ball in. So take that on board, have a look for yourself, and then again, make sure once you've done that you feel like your neck is freer, but also you can then reassess your jaw movement to get a direct understanding of what this can do to your jaw straight away. So highly recommend that as an exercise. Now, again, following on from this idea, you need something to free up the tissue around the jaw, make it function better, treat those symptoms. We need something to treat the neck dysfunction that often perpetuates jaw dysfunction. But then we also need to have a final conversation about, well, why is that part of your neck a problem? Why is one side more stiff and tight and restricted than the other side? When our expectations should be that you should feel good all the time. Everything should be normal, shouldn't be stiff or tight as a rule of thumb. It's not due to age, it's not a part of being a human being. It's something that you've accrued without realizing it. And again, if you follow these videos, you'll probably know where we're going here. In order for this part of your neck to become dysfunctional or to be asked to become dysfunctional, you have to put it in a weird position. So what we often find with a lot of people with jaw pain is that they often adopt one of 2 shapes or potentially both. So the first one often, and you recognize this one, it's often looking down. So we have to get you into a position is once you've found which part of your neck feels the stiffest and tightest. So let's just say for the purposes of this section of my neck, and if I can make this easy to see, is where the stiffness is. what this tells us is throughout the day, you have to be putting your neck into a position where you're bending your head down, looking down enough to bend your neck enough to create a hinge through that part of your neck so that your body over time is asked to stiffen to resist that and to deal with that. So that often for a lot of people can look just something as simple as using your phone. It can be reading, it can be leaning back, watching TV on a laptop, computers, arts and crafts, instruments, anything. And it doesn't have to be one thing. It can be a common theme of being stuck in a position where you're looking down. So it's important to recognize that. The second thing is almost the opposite, where we adopt this sort of relaxed slouchy posture, and instead of going down and looking down like this, we often then have to hinge our necks back to look forwards. So this often looks like the chin poking out position. So instead of looking down and hinging through this position in neck flexion, what we're essentially doing is hinging into extension to make up for that slouch position. So again, in a perfect world where the neck should be up nice and tall, when we slouch through our upper back and shoulders, if we keep our neck in the same position, we often end up looking down. But if we need to do something that involves us looking forwards, we have to extend our neck and almost poke our chin out to bring our eyes back to level. If I keep this position, but then straighten this back up again, essentially the position that we're in is just looking up the whole time. So we're jamming up those joints consistently. So the bottom line with this is, if you have jaw pain, TMJ joint, TMJ dysfunction, I know I'm having trouble saying that, but the point being is that wherever that stiffness and tightness is in your neck, there's a position that you're getting into day to day, or a theme around a certain neck shape that you gravitate towards without realizing it, that's putting your neck into a position that it's not enjoying over time. So that can be in bed reading, that can be at work, that can be at home, that can be driving on the couch. It doesn't matter what it is. From the moment that you wake up to the moment you fall asleep, there has to be something that you're doing with your neck that your neck isn't enjoying. And it's not hating that enough to give you pain and dysfunction, but you're putting it in a position for long enough that it's having to adapt to that position by stiffening up. And the flow and effect of that is it's expressing itself, or it can express itself in a number of different ways, one of which is jaw pain and jaw dysfunction. So we always want to point that out, that just treating the jaw on its own can be helpful. There's certainly a lot of strength exercises and fancy exercises you can do to treat the jaw, a lot of massage techniques, some stretches that you can do, one of which we've gone through today. But then if you're not talking about the neck and trying to improve the function of your neck, and then also making sure that you then put your neck in a better position after that, we're missing such a big part of the onset and the creation of jaw pain that we can just tick off, and it allows this to settle down a lot faster. So hopefully that's really useful information. So let me know in the comments below. Let me know if you've got some jaw pain. Let me know how it's going. Let me know if this information is helpful for you, whether you've been someone who's just been pushed towards jaw-specific exercises and you didn't necessarily know the huge connection between neck dysfunction, poor posture, and jaw pain. Let me know in the comments below. Following on from that, if you did enjoy this information, please consider leaving a like below and consider subscribing to the channel. It really helps these videos get out to more people. It helps this information spread a lot better. So it obviously helps support us at the same time. So as always, look, thanks for stopping by. Thanks for watching. Hopefully it was useful. And until next time, we'll see you soon. Bye.